Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
We're live in Boca Raton on WSBR and also on WWNN. And we have a very alive physician, Dr. Burton Feinerman, who is a specialist in working with stem cells. That's really a very, very important issue coming up. We read about it all the time now, Dr. Feinerman. I know you've been working in medicine for many, many years, and it's kind of exciting for you, isn't it, now that it's really out there on the cutting edge?
Oh, yeah. Well, it's definitely has made my life exciting and interesting and rewarding to be able to help people that are considered to have so-called incurable diseases. I'm thinking about, as I say that, about my friend Trimble. That's his first name, and he's a professional drummer. He's 65 years of age, and he was hit with ALS about 2 years ago. And Trimble is a very charismatic and fun guy, and he doesn't let his ALS slow him down. He still has gigs where he goes and plays in various places in Fort Myers, and when he plays the drums, he has a special kind of glove on his right hand, which is weaker than the left, so that he can still handle the drums quite effectively. And he doesn't. He fights through his illness and condition remarkably. I watched him for about an hour the other day doing physiotherapy and going through all the things, and I know it was uncomfortable and painful, but he never once complained, and he kept going. And he's a candidate for neuron brain stem cells that we mix with a number of other agents like brain-derived neurotrophic factor, nerve growth factor, neurotrophins, and glial cells. And these are all placed in the lower spinal tap. So it's a simple, painless procedure. And this allows us to get past the blood-brain barrier. A caution to people who have neurological conditions and are seeking out help, that it's very important to first get the right kind of cells. And the right kind of cells are the adult neuron brain stem cells, plus these numerous brain nerve growth factors that I just mentioned. But it's also very important that you administer it intrathecally, in other words, a spinal tap. If you try giving it intravenously, it's never going to get past the blood-brain barrier. And so when some of these clinics offer you treatments in which we'll take stem cells from your fat or your bone marrow, when it comes to neurological conditions, it's not going to be effective. And if they give it intravenously, it's not going to be effective. So that's an important thing. And treating ALS or Parkinson or Alzheimer's also involves realization that there may be deposits of abnormal tau or another agent called amyloid or misfolded proteins that will interfere with the communications from the different nerves with one another in the brain. So certainly neurodegenerative diseases are something that I find fascinating. We're working on other additions, because it's always fascinated me how the heck Stephen Hawking, who was diagnosed with ALS when he was 25 years old, and he's still going at it at 75 years of age.
But he has lost all of the use of his body, in a sense, even though he's doing it, right?
Yeah, he's got his brain working. He's got various neural implants in different parts of his brain, particularly for the motor areas, for his arms and hands and legs. And unfortunately, he hasn't opened up to the world exactly what has been done. You know?
Yeah, but let's go back to what you said, though, with Parkinson's and ALS. to be able to not to get to his condition. So now someone has this disease. Will stem cells stop it, or is it just going to slow it down?
Well, no, I've seen people where it has absolutely stopped it. Yeah, absolutely stopped it. Now, what I have found during the last 10 years that I've been working with stem cells is that it's not something that you can always expect a one-time treatment is going to do. And so I've devised, I haven't devised, but it's for a long time they've used what's called a brain reservoir. And it's about the size of a walnut. So just picture the size of a walnut, maybe a little smaller, and it's hollow inside, and it has a tube, a plastic sterile tube connecting itself to the lateral ventricles of the brain. So this is commonly done when people have brain cancer, and they put this brain reservoir in just below the scalp so that they can introduce the chemotherapy directly into this reservoir, and it goes directly into the brain rather than giving it intravenously or even in the spinal canal. And so this is something that we've introduced to treat all of the neurodegenerative diseases, Parkinson, Alzheimer's, or ALS. Certainly, another area that's opening up is brain engineering using these neural electrodes placed strategically in the brain. Actually, when it comes to Parkinson, it's actually been done a long time ago. They have what's called a deep brain stimulator, but that's it. But when it comes to treating these conditions, especially ALS, you really need to have implants in various parts of the brain, obviously by skilled neurosurgeons who have been trained in this field of what I call brain engineering.
Dr. Feinerman, let me just introduce you again. Dr. Burton Feinerman is my guest. He's really the first expert that I've really been so mesmerized by with his work with stem cells, and he's actually has an office in Wellington, right next to the Wellington Regional Hospital. But I want to just kind of piggyback on what you said when talking about Parkinson's. So what is Michael Fox doing? Because he doesn't seem to be getting worse.
Well, I am sure that Michael Fox has had many a stem cell treatment, I would imagine.
I hope so. He doesn't talk about that, but I would like to know that.
Yeah.
Does he talk about it?
No.
Why don't that's what you brought up, an important point. Why aren't people talking about this when they're celebrities?
Yeah. I mean, I don't know, for example, like what Cassius Clay, Muhammad Ali has done. I can't picture that he's done nothing. And Michael Fox, unfortunately, had Parkinson at such an early age and had to stop working. And I think recently he came back on TV. And so
he looks pretty good.
Yeah. And so there's no question that he's had some form of stem cell treatment. I'm sure probably exactly what I've described to you. But why they don't talk more about it openly to the public? That's a big problem. Like, I'm only 86 years old, and so I go to the nephrologist and I just point out to him that I see that I'm spilling a little albumin protein in my urine. My BUN and creatinine's up a little bit, and my glomerular filtration rate is down about 15%. So I said, what are we going to do about it? Well, he says, well, we have to make sure you don't have diabetes. If you do, we'll put you on some medicine for that. We'll check your blood pressure. I said, all of those things are completely normal. I said, what are you going to do about it? He said, well, I don't know. You're 86 years old.
Yeah, you're old. Right. Accept it.
I said, well, I intend to live until about 105 minimum. And so you better find a way to do something. Well, of course, that never occurred.
Go to Dr. Mencia; he'll figure it out. I have to tell you.
No, but Dr. Feinerman, sometimes, unfortunately, I have to go to the best doctor I know.
Yourself.
And so, like even right now, I've got 6 patients lined up for treatment. Unfortunately, I could not find a interventional radiologist to cooperate with me, and so to do something that's completely FDA approved. So I'm going to treat these patients at a hospital in Cancun, which is very modern and with excellent interventional radiologists and other doctors, and these people. Well, I mean, a couple of them have what's called polycystic kidney disease. That's that. People don't really know too much about that, but it's actually quite common. It's a genetic disease, and what we have to do is first we knock out the abnormal gene mutation, we insert the normal gene, and then we introduce stem cells that, in this case, are from their body, mesenchymal stem cells that we get from their bone marrow, and but if you give it intravenously, 90% of those stem cells will end up not in the kidneys, oddly enough, they'll end up in the lungs. And so giving it intravenously is really not helpful. So we're going to administer these stem cells directly into each kidney with the help of an interventional radiologist. Also, it's been discovered that an agent called immunoglobulin A, when administered into the kidneys, will actually break up and destroy the thousands of cysts that occur in these unfortunate individuals. So that's pretty exciting stuff.
Well, let me tell you, we were just there we were on a press trip to the Maya Riviera, and we have to come in through Cancun. And then you're driven about 25 minutes away. It was very lovely, but I was thinking about you because of what happened. And I pick up a newspaper, a local newspaper in Cancun, and it talks about major stem cell clinics there, and one of which was treating a very famous, I think it was either a soccer player, very famous athlete. And I have it, and if I haven't sent it to you yet, it's ready to be sent to you because I was so impressed, and now that I know you and I was reading it, and he gets his treatments, and he's saving his life. I mean, it's just amazing what's happened here.
Yeah, but isn't it sad that the greatest country in the world is by itself, scattered throughout Europe are stem cell centers, all throughout South America where I've worked quite a bit, particularly in Lima, Peru, and there's an excellent center, but it's still 5.5 hours away from Miami, Florida, and plus the doctor I work with, he only speaks 4 languages fluently, but the rest of the staff don't. And it's still, and a lot of these people are very sick, and to have to travel that long on an airplane. And so and of course, in Asia, you've got excellent stem cell centers in the Philippines, in Thailand, and especially in Singapore, which is the highest level of stem cell research anywhere in the world.
I didn't know that.
Yeah. Singapore, their economy, let's say roughly 8 to 10 years ago, was declining. It was mostly dependent upon electronics. And so they decided to set up a center, a large area in Singapore. You know, Singapore is both a city and a state, and a city and a country. And they set up a section called Biopolis, and they attracted the most brilliant Nobel Prize winners and scientists and doctors from all over the world. And they are the supermen of medicine.
Well, that's amazing. I was in Singapore. I went on a press trip there. My husband and I did, and I actually have fantastic dishes that I bought there. And I was amazed at that place, but this was probably about maybe before that happened because it was about 10 years ago. So the big problem with that, though, and as you just said so well, someone who's sick has to travel, and going to Singapore was a long way.
Oh, yeah.
And even though once you get there, it's wonderful and they treat you right, people who are ill shouldn't be flying on airplanes those long distances. And I don't know what we can do with our government. I mean, they do so many strange things, but the fact that it's shown all over the world that it works. Why we can't do that?
Yeah.
I mean, now that it's not going, and of course they've had the embryonic stem cell, that was a big thing going, but now it's not that. It's people's own stem cells. And you said that you have made some good inroads in that. You've been able to talk them into something.
I mean, definitely with kidney disease. On the same trip that which is just about less than 2 weeks from now, I'm treating some severe diabetics. One of them is on an insulin pump. He's only 20 years of age, and he's already developed kidney disease and glaucoma from his severe diabetes. And we'll be able to implant the pancreatic islet stem cells right in his pancreas.
But here in the United States?
No, they're in Cancun.
This is the one.
In Cancun.
But you said there was something you can do here.
Oh, there are.
It's just,
treating lung diseases can be done definitely here. COPD, pulmonary fibrosis, emphysema.
No, why is that?
Well, because you use the patient's own stem cells either from their blood, bone marrow, or fat. And as I mentioned earlier, when you introduce those intravenously, 100% of the stem cells go to the lungs.
Yeah, I see.
You capture that wonderful product and with very little discomfort no discomfort to the patient.
Well, there are a lot of people with COPD. We should really be talking about that too, that they don't have to travel. They could do that here with you, right here.
Yeah. Lung diseases can be treated in the United States. Of course, I would say that there's only one group that really has jumped into stem cells, and those are the orthopedic doctors. And so people that are considering a hip implant,
transplants, implants.
or a knee transplant, should certainly go to orthopedic doctors first who specialize in stem cells, and at least get an opinion that may save them the need for that.
That's a very, very good point. I want to tell everybody how they can contact you. It's really important. So remember, this is Pencil Talk Radio. We are live here in Boca Raton at the studios of WSBR. And also, we are simulcast on WWNN, same time. The phone number to call, though, to talk to Dr. Feinerman, I will give you his office number, is 561-557-3358. Or if you're really pretty serious, you need to talk to him right away, you can call his cell phone, which is 941-592-6613. Again, that's 941-592-6613. And he has great websites. One is called stemcellgeneticmed.com. stemcellgeneticmed.com. And then, of course, we have one which is really we haven't talked about macular degeneration, stemcellmaculardegeneration.com. We have so much to talk about, Dr. Dr. Feinerman. We go so fast, and but we do, just even, there are a lot of shows that have 5 minutes. At least we get almost 30 minutes, and
right.
People are learning so much from you about stem cells. I appreciate your being here so much.
All right, thank you. Well, we've been talking about some of these really horrific diseases, but a disease that doesn't threaten life but affects life and marital relations quite seriously is erectile dysfunction in men. And as men age, they often turn to things like Viagra and Cialis, which often help them, although there's some people suffer from some serious side effects, especially when it comes to vision. But that's a very small percentage, and and those medications, if used properly and not too often, can be very helpful in that situation. But as men get older, these agents are not effective, and often men will then go to an ED clinic. When they go to an ED clinic, they're given a mixture of 3 or 4 compounds that are put in solution, which are given at the base of the male organ. And they, in terms of satisfaction and feeling macho, they will achieve an erection that's quite striking, and it will last for about 2 to 2.5 hours. And but yet, it's somewhat among married people, it probably can be achieved. You just excuse yourself for a few minutes, you give yourself an injection, and then you hop in bed with your spouse. Single people, it might be a little bit more troublesome, especially when you don't want the other person to know that you're using a chemical to achieve an erection, and so you're fondling your loved one, and then you excuse yourself for a couple of minutes to go to the bathroom, give yourself an injection. That can also be misused, and some men, unfortunately, tend to use it too often and have some serious consequences as a result. But now, men, once they have this condition and they've tried the Viagra and other simpler things, we have a technique in which we use various agents. And what we're trying to do is restore the male organ back to a normal function of a 30-year-old man. And the agents include things like the gene that makes nitrous oxide, also agents that help to restore the proper lining of the blood vessels of the penis. Namely, we give things like endothelial cells and vascular endothelial growth factor, and then also some neuron cells to restore the nervous tissue in the penis. And so what we're achieving is a normal male organ, and this has been extremely successful in 20 patients that I've treated so far. And
you can do it here in the United States.
Yeah, and this can be done in the United States.
Where do you actually inject? Where do you take it from, or what do you inject it in the base of the penis? The same thing as you would the other.
Well, there are 2 large blood vessel areas. One is, and it's called the corpus cavernosum, and you inject under local anesthesia. There's no pain associated with it. These agents. And this is something that could probably last for many years, just a single treatment. So it's not like you have to go running to the doctor often to have it done. I don't have enough experience yet to know how long, but so far a good 6 months have passed by, and everyone seems to be smiling.
All right, so let me just go over this. This is a great subject, especially for our listeners. So in other words, though, it doesn't mean that the male organ is erect all the time. It means that when you want it to be erect, it has that potential because of when they were younger, it had it.
Right.
So this is very exciting stuff, and I think that we have a lot of men, of course, are all looking for this. Mostly the gentlemen now in their 60s who are baby boomers. They want a new life, and this is very important. You just look at the television. They have all these ads on constantly about this. So if they could go to you and get this done, wow, what a wonderful thing. Let me give Dr. Feinerman's phone number again. His cell phone's 941-592-6613. That's 941-592-6613. Also, and as I said, he's located in Wellington. But let me also give you his website. It's stemcellgeneticmed.com or stemcellmaculardegeneration.com. We haven't even talked about macular degeneration, and I think we've run out of time, but maybe your article coming up, if you wanted to do it on that, because that is such a big disease going on in the older adults, and you've seen success in that.
Yes.
Okay, well, that's a great way to end this, that we have about a minute or so. So you're probably feeling, I know you've just moved down here. You used to be down here years ago, and now you're back. Mm-hmm. And you have this wonderful smile on your face because you seem like you're so happy when you can help people feel better and do better.
Right. Well, I'm fortunate also that because of attention to me, of which you've been an important part, I've had some people from London, from the Middle East, and South America who want to take my company public, and that's that's a process that's already been started already. So lots more to come, and so I say to my friend, the nephrologist, and my cardiologist, you just got to keep me going until I'm 105.
At least, of course, in our book, Live to be 100 plus, that's nothing, now compared to...
If I could just, we have a second or two, I want to remind Anita about how she made a comment, which is, I wrote in my book that I published about almost 4 years ago, in which we talk about all these diseases, but she pointed out in this recent cure symposium about prevention of these diseases. And so stem cells can not only treat the horrible conditions, but what about preventing? And that's the program that we have set up as our anti-aging sector.
Okay. Well, we're out of time, but we have so much to talk about and so much to read about. Thank you for joining us, and